Disruptive impulse control and conduct disorders are a class of diagnosis characterized by difficulties controlling emotions and behaviors. These disorders frequently involve uncontrolled impulses, leading the individual to violate the rights of others through acts of aggression or destruction, as is the case in pyromania. Pyromania remains a relatively under-researched and possibly under-reported impulse control disorder. The strong urges to watch existing fires or to set new fires may lead individuals who meet the criteria for pyromania to engage in acts of arson, often endangering their own lives and the lives of others. This is considered a significant risk to the individual with pyromania and those around them. Now on to the symptoms of pyromania. Pyromania is hallmarked by the fascination with and attraction to fire and fire-starting paraphernalia, as well as the deliberate and repeated setting of fires. Individuals diagnosed with pyromania often experience tension or affective arousal before setting a fire, and feelings of pleasure, gratification, or relief during or after fire starting. Fire setting is not done for monetary or other gain, to conceal crimes in response to delusion or hallucination, or as a result of a lack of judgment. Additionally, the fire setting behaviors should not be better explained by conduct disorder or other psychiatric illnesses. Individuals with pyromania commonly spend time closely associated with fire departments or even becoming firefighters themselves, and are often seen watching fires in their neighborhoods. It's not uncommon for these individuals to set small fires or to set false alarms in order to see firefighting equipment, as noted by the American Psychiatric Association. Pyromania is diagnosed significantly more often in males, particularly in those with poor social skills or other learning disabilities. Though it is unclear why gender disparity remains so strong, the diagnosis of pyromania is typically based on criminal records of repeated or suspicious fire setting and patient reports regarding their emotional relationship with fire. The mechanisms behind pyromania are unclear, and patients often experience episodic remissions in fire setting urges, as noted by the American Psychiatric Association. Patients should not be diagnosed with pyromania if their fire setting occurs as a result of conduct disorder, antisocial personality disorder, as a result of hallucinations or other neurological conditions or intellectual disabilities, substance intoxication, or with monetary, revenge, or other malicious intent, as also noted by the American Psychiatric Association. Now on to the comorbidity of pyromania. Pyromania often occurs alongside a past history of alcohol use disorder and is most commonly comorbid with antisocial personality disorder, bipolar and depressive disorders, substance use disorder, and pathological gambling. Pyromania very rarely appears as a primary diagnosis. One study conducted evaluated 21 subjects diagnosed with pyromania, of which 10 were female and 11 were male, and it concluded that the mean age of onset was 18 years, with fires set every 5.9 weeks on average. While many of the fires set by individuals in this study did not meet the criteria for arson, they did match the emotional anticipation and release patterns consistent with pyromania. Over half, which was 13 of the 21 participants or patients, were also diagnosed with comorbid axis 1 mood disorders, and 10 diagnosed with other impulse control disorders. Further research needs to be conducted on pyromania to clarify the possible etiologies and comorbidities associated with the disorder. Now on to the prevalence of pyromania. The true prevalence of pyromania is currently unknown. Pyromania has been estimated to occur in approximately 1.13% of the population based on population sampling, and has been diagnosed in only 3.3% of individuals incarcerated due to repeated fire setting. Therefore, it is unclear just how many individuals in the general population may meet the criterion for the diagnosis with pyromania while channeling their urges into safe fire setting techniques. Currently, over 40% of individuals arrested for arson in the United States are under the ages of 8 years of age, indicating that fire setting in adolescence is a significant concern despite the fact that childhood diagnosis of pyromania remains quite rare. In these cases, it is important to distinguish between the criteria for pyromania and fire setting behaviors and conduct disorder, attention deficit and hyperactivity disorder, and other adjustment or impulse control disorders. Further evaluations on fire scenes by forensic mental health experts, including but not limited to those attributed to arson, may provide more extensive insight into the nature and prevalence of pyromania and breakthroughs in potential treatments. Through careful forensic analysis of fire scenes, experts may be able to provide more accurate data regarding the prevalence of intentional fire setting and techniques used in lighting these fires. This data may be useful when analyzing the tendency for individuals with pyromania to obsess over paraphernalia related to fire, such as matches or lighters. Now, as far as the treatment of pyromania, there's a strong indication that individuals diagnosed with impulse control disorders, including pyromania, may respond well to an approach including the use of psychopharmaceuticals. These may include selective serotonin reuptake inhibitors, opiate antagonists, mood stabilizers, and the typical use of antipsychotics, all which may contribute to the successful reduction in the symptoms of pyromania. More recent research indicates that the use of beta blockers and lithium may also be successful in controlling the impulsive symptoms of pyromania. While research into the use of these new things are primarily based on case reports, the initial results are promising and should be followed with double-blind clinical trials. Ultimately, there has not been a significant level of success controlling the symptoms of pyromania through any one specific treatment. There's still a gap in the body of literature related to the treatment of impulse disorders and may make treatment of pyromania difficult. The interest in fire and the presence of antisocial behavior are significantly and positively correlated with antisocial behavior and is strongly predictive in fire starting behavior. This indicates that children, adolescents, and adults who demonstrate antisocial behaviors and interest in fire should be monitored and kept in treatment to prevent urges associated with pyromania from emerging in a dangerous manner. Due to the potentially dangerous or even fatal consequences of pyromania, not to mention the possibility of conviction and incarceration for arson, individuals should remain in lifelong contact with a qualified psychiatric clinician.